Welcome, Nate. I'm so excited to have you today. We've been having this conversation many times about health insurance for teachers, but today is a special day because you're married and you're expecting a baby. So thank you for sharing that with me. Welcome.
Yes, thank you so much for having me on again. It's always a pleasure anytime we get together and chat. Thank you for the well wishes. Yes, my wife and I, who is also actually a teacher, how I got involved with the group in the first place. We got married back in October, and our first a baby girl is going to be due in August.
Beautiful, beautiful. All the blessings. So let's start, taking some this pressure off of this health care insurance in the United States. So
Yes.
tell me, is it hard for a teacher to buy an insurance outside of the school system?
So the difficulty lies within it's it's not difficult to purchase health insurance whatsoever. The difficulty comes from making sure that you're finding a plan that will best suit your needs and your budget, and perhaps most importantly, finding somebody that you trust to be able to guide you through that process. Um, there's a lot more people out there that maybe have bad intentions than good, so it can be absolutely paramount in terms of who you put your trust into, to help guide you through that process. And since one of the primary principles of my business is integrity, being honest and forthcoming and providing all of the information needed to make an informed decision when choosing your next policy. Um, that's why I hope I can serve as a resource to whoever needs it.
Yes, awesome. There is a box around your video. Is that because something else is on? I just don't want you to.
Uh,
There's a box around your face.
yes, I
Almost full.
actually I'm seeing that now. Um, Give me one moment. I'm
Yeah.
I'm sorry to do this.
No,
Let
no,
me see
that's
if I
okay.
can
We'll pause for a sec.
it
For you
sounds good.
to, I just don't want it to look bad at the end.
Sure, sure. One moment.
That's okay if it doesn't go away. No big deal. Just want to inform you. It's still on. It's okay. We'll fix it next time. It's probably just zooming in. It's camera. It's okay. Technology happens. So those of you who are watching, this is going to be an interesting conversation. So if you have any questions about insurance, Nate is the guy to go. And I really like Nate, and I've been working with Nate for over close to now 2 years, when sending our coaches who are part of our program to Nate, because Nate loves to educate. That's really important. That he really loves to educate his audience before he actually makes you enroll in anything or gets you to enroll in anything, because education is what's missing in the healthcare. I think in the United States, it's a lot of people think what I get offered in the school system is the best plan I have. But as Nate will point out, because I'm not the expert of this, but he's been doing it for so long, and he can actually offer this across all over. And there are a few states he can, and that means that he can get you connected with the right people. So as he said, it's really important to know the details of it, right? Because a lot of the time these documents are too heavily loaded with lots of words and meanings that we might not understand how to equate them to. So that's the problem. So I would say that finding the right person is innate. If he's available to all of you, he offers this free service where you can book a service with him, call with him, and he'll go over what you need to practice, what you need to ask, the right questions to ask, what needs to be included, who's included, how many people are included, and what do you need. And he knows different packages that are offered in the United States, so teachers can find the best. You have any questions as we wait? So when Nate comes back, we can really ask him those questions. So anyone has any questions who's watching, please do put it in the chat, because I can see it and I can ask him when he comes back. So who in the groups and wherever I'm hosting this, I'm asking you if you have any questions for Nate, drop that into the comment section and we'll get started soon. He's just fixing his camera because I didn't like the way there was a square around his face. We couldn't even see his face a bit, so that's why I asked him. So, those of you who are in these groups who are struggling to make that decision, do I stay in teaching because I need this healthcare? Because if that's the decision that's holding you and you no longer wish to be there because you don't feel like it, or whatever your circumstances, it is something you need to decide. And if healthcare is the one thing that makes you scared of leaving, I would strongly recommend you connect with Nate or someone like Nate. But Nate is my favorite because not only he gives you advice, but he also shows you the education piece of it, right? All need education on these things because they're not easy to comprehend. So Nate, that's okay. We'll just get started and then we'll just fix it later. It's okay.
All right, so I apologize for the technical difficulties.
No problem.
We're just gonna power on through.
Yeah, that's
So
fine. We can just see you in a box, but that's fine. But here, what I was telling my audience, our audience, is that one of the things that teachers struggle with is I need to stay in teaching because I need the healthcare, right? That's one of the things in our group. If you see a lot of
sure.
discussion, it goes around. There's no way I can leave because I won't have healthcare, and I want you to tell them, is that true?
So the the thing with employer health coverage, that's offered through the teachers by the district, um, there's really two main reasons why it will make the most sense. Now, one of them is pretty obvious. It has to do with the cost. So, the cost of covering, whether it's an individual, whether it's a family policy, it's almost always going to be cheaper by going through the employer. If it obviously varies depending on the state and the school district, but by and large, most teachers will say, yes, I carry the insurance for my family. It's myself, my spouse, my two children, and we pay $600 a month. I'm just, making up numbers here, but that can a lot of times be not only the best price by a lot, but it also offers pretty comprehensive coverage, which kind of ties in with the other reason that a lot of people will choose to stay. Um, when it comes to employer group coverage, that is usually the best way to get something covered if you have some sort of a pre-existing health issue. Now, pre-existing health issues can constitute a very large number of things. It could be something very minuscule where I take one medication a day to treat a condition and I have no issues with it. Technically, that is a pre-existing health issue, but it's obviously something that's very well managed and well controlled. The alternative, of course, is if it's something more serious, someone dealing with cancer or heart disease or a chronic issue that maybe needs to have some sort of a surgical procedure done. It could really be anything, but employer coverage tends to cover those things the best. So if you are looking to make a switch where you are no longer going to be having group coverage that would provide for these type of items, again, it all becomes very important to select the right plan that is going to, be able to help you in that respect. If I do have several medications and several conditions that I'm treating, I need to make sure I find a policy that's going to take care of those things. If I am obviously in excellent health, perhaps looking at a medically underwritten option, a private plan as it's sometimes known, that's the vast majority of what I work with. A lot of times that can make sense for people and also offer a lower cost alternative to getting insurance through their company.
So, what is it that a teacher should look at when buying outside of the school system? Like when they leave the school system and they're like, okay, I don't have health care, I need to figure this out. What's the best way to go about finding that plan?
Um, so there's a few things that I would suggest looking at to start. Um, Price is not one of them because as soon as I find a plan that in insurance, if it sounds too good to be true, it usually is. So
Mm.
if you don't feel like reading through the entirety of the fine print and finding where the catch is, so to speak, that's something that I can of course assist with. But um, you're really kind of looking for, I would start with just three very basic numbers. Um, the deductible, of course. What is the cost that you must first satisfy before your insurance company is going to start providing you benefits for the different things that you need it for? Your out of pocket limit, or out of pocket maximum as it's sometimes known. This is, while the deductible is what you pay before anything starts getting paid for by the insurance company, the out of pocket limit is going to dictate what you might need to pay before everything is covered at 100% by the insurance company. So the stage in between that is co-insurance. Usually that's going to be a couple of numbers. If it's 80-20, if it's 70-30, this is the sharing of costs that you would be doing in between meeting your deductible and your out-of-pocket limit. Another one that's very important is the type of network that it uses. The most common ones, of course, are HMO, Health Maintenance Organization, and PPO, which stands for Preferred Provider Organization. The former is oftentimes a little bit more affordable in terms of its overall cost, but it is more restrictive in how you can use it. You can only take it to certain facilities, certain doctors. You must first see a primary doctor for everything that you do, and after which point you would be required to be referred to an in network specialist. Um, the PPO plans work a little bit differently, where you actually would be able to see any doctor, visit any facility that you want to. It's also not going to be just limited to the state where you live, which is how HMOs work.
Hmm.
Most importantly, with PPOs, those are the ones that provide folks with discounted rates on the actual medical services when they use them. So while the premiums may cost a little bit more at times, it usually results in less out of pocket exposure in terms of the money that you're actually using towards your healthcare expenses.
Okay, so what I'm understanding, because it is a lot when you start speaking into the language of it, I'm like, oh, I'm getting lost in it, but I
Exactly.
tried to stay focusing,
Correct.
centering and focusing. But I want to ask, so is it fair to say that sometimes you have insurance because you don't know these fine prints? Like, for example, from the school system, you're not really covered as much as you think you are. Is that fair to say?
So for this, I am reminded of an instant where I spoke with, as I mentioned, my wife is a teacher, and she just started at a new school this past year.
Mm-hmm.
Over the summer in 2023, I actually spoke with a woman who is the counselor at her school, and this is a woman who is, um, probably late 30s. She's not married. She has no children. So it was an individual policy that she has, and she just wanted to get a better understanding of health insurance. Of course, she went into it with an open mind. Hey, if there's something better that's out there for me, I would be happy to look into it. But at the end of the day, I just want a better understanding of the coverage that I have currently. So she and I sat down and we did a review of her policy. I also was able to run quotes for her and provide her some alternative options, including one of my own plans. But where we kind of came to the understanding is, hey, your coverage through the school is, I would qualify it as good, not great. It's through a large company. The deductible and out of pocket limit are not very high, but the price was far and away the most affordable option she was going to find. My plan that may have had a little bit better coverage was about 2 or 3 times as expensive as what she's paying now. So for someone who doesn't really go to the doctor that often, other than when she's sick, it wasn't going to make sense for her to start paying 2 to 3 times as much per month, even if it is a better plan. At the end of the day, it's all a very individualized approach to it. Some people are going to say, I never go to the doctor. I never use my insurance. I just want to pay as little as possible because I know that I need to have it. So the coverage comes secondary to the price. There are other people that, they may use their insurance a little bit more. They may have some medications, some routine testing that they get done every year, and they understand the value of having a good policy. They want to get the lowest deductible, they want to get a PPO, and for them, the price is secondary to the overall level of coverage. So, whoever you are, whatever your situation is, I want to talk to you. I want to help you because whatever it is that you're looking for, even if it's not through me myself, I have built up a network of referral partners over the last 3 years. Some excellent people that are able to service, um, I believe, every state in the United States, depending on what the product is. So even if I myself cannot assist you, I can get you in touch with one of my trusted referral partners who will be able to find you the help that you're looking for.
Yeah, absolutely. So you're saying that, okay, so teachers are right now so confused because I want to give them clarity. That's our meeting today, is to make sure they get clarity, right? The clarity that they're looking for is, if I leave teaching, can I buy something outside? You're saying yes, you can. It can be a little bit more expensive than what you are provided by them, because at the school system, because they do go through a larger company, so there is some, but it's possible to buy. And you're saying it's three times, sometimes two times more, three to four, sometimes more than what they make
All
it.
anything price related, I assure you, is the last thing that I discuss because a lot of the other information that you provide me with is going to dictate the overall
Yeah.
cost of your plan.
Yes.
Um, so if a teacher were to leave the education system,
Mm-hmm.
1,000% yes, you can purchase coverage. In the United States, as it's known, the Affordable Care Act, Obamacare, healthcare.gov, there's a lot of different names for it, but those, since we are in the special enrollment period as opposed to the open enrollment, which runs from November to December each year, if you are leaving an employer and losing qualifying coverage through said employer, aka the school system, then you would actually have a 60-day window that would open up in which you could go search for and elect shop coverage. Now, that doesn't necessarily mean that healthcare.gov is going to make the most sense for each person. But whether it is one of those plans, which you have the 60-day window, whether it's one of my private plans, which are not subject to any sort of open enrollment periods, I am able to sign up clients year round to those types of policies. Um, Whatever it ends up being, you do have options available to you. Another one is something called Cobra, which is a continuation of your prior coverage through the school system. The difference is, instead of you getting the plan at a discounted rate, where it's important for people to realize that when you leave and you're getting insurance through the school, it is going to cost more
Mm-hmm.
because what you are getting is a plan at a discounted rate, because you might be getting 50, 60, even 70% or more paid for by the school, and you're only asked to cover the remainder. When you leave the school and therefore they have no more incentive to continue continue contributing towards your health insurance, that's when you see Cobra, and the plans go up to, for a family, it could be 1,000, 1,500. I think the most expensive I ever heard was someone who was expected to pay over $3,000 per month to continue his Cobra coverage. Now, it can also depend on the size of your family, your age, and where you live. There's a number of contributing factors when it comes to price, which is why I always wait till the end to discuss that. But if you are looking for options, you should probably expect it to be a little bit more than what you're paying when you are a part of the school system, though you will have numerous options that are available to you.
Okay, so when you say that, now I get it. So when I go out, I'm actually responsible for all of it, versus when I'm in the school system, I'm only 30 whatever percent responsible, and that's
Correct.
how I
And
see it expensive,
and
right?
I do want to also clarify that with Cobra coverage, you are able to maintain it for a maximum of 18 months. So if I am, if my insurance as a teacher runs through the month of August and then the new time would start in September, I would have 18 months from the end of August in which I could elect to continue the coverage through Cobra if I don't find anything that is a better fit for me or a better price. However, once those 18 months have expired, I would then need to seek out a permanent next policy because I would no longer be able to continue with my prior employer.
Okay. So I'm not a US citizen. So can I ask a question? This is just me. It's very
Please.
curious. Curious. So does so is there one if you're not making money and you're like don't have a job, is there coverage by the government or you must have it? Like if I, let's say I don't have anything and I'm not I can't afford nothing. Do I not get any service at all if I don't have a covered? Is that what it is?
So there are two main ways that you can get government insurance. One of them we already talked about is the ACA, Affordable Care Act, Obamacare, healthcare.gov. Um, that is going to take into consideration your income in order to determine if you qualify for any sort of assistance, a subsidy, a premium tax credit, as that's also known. So that will factor in your household. So not just yourself, but if you have a spouse, if you have any dependent children or other dependents that are earning a wage, all of that would be, put into one figure. And they are currently looking at the household gross, aka before taxes are taken out, income for the year 2024. This would, of course, be an estimate since we're only 4 and change months into the year. This is what you expect to be your gross income for the whole household by the time 2024 is finished. However, if the income number that you provide is below a certain threshold, then at that point, we wouldn't even be looking at healthcare.gov. We would be looking at your local or state Medicaid program, also known as CHIP for children. Um, there are certain instances where, if I have if I'm married, I have two children, but I'm the only person that works and earns a wage in my household. Maybe my income is $40,000 before taxes. With the size of my family and that level of income, I would most likely be told to go apply for state benefits through my state Medicaid program, at which point, when I am approved, I'm able to get a medical card and go get the vast majority of medical and dental services done at no cost, and I do not pay anything for this program. However, Medicaid can be a little bit tricky. Some of the regulations change when it comes to maternity and pregnancy. You can get approved for Medicaid if you are pregnant and have no other insurance options, but they may only cover you until such time that your child is born. After that, they would see your income again, they might cancel it, and then from there you would have to go out and start your search all over again. So it's very important to, if you're dealing with Medicaid, since that's one of the things that I'm not necessarily able to help with as it is a state run program, I usually suggest consulting with either their phone number or by going to like a local Medicaid office.
Okay, awesome. So let's talk about how you help people because the reason that I bring you back again and again about this whole healthcare is because the way that you work. Because I'm a holistic person, everything I do in my life is holistic. So when I met you, you had that same approach to healthcare and how you help people, right? So give us how you help a person to decide or just even the education part. I find what you do is very fascinating in a world where everyone's like, here's your policy, sign here and let's go, right? And I'm like, I don't even know half of the stuff it says in this thing, but I'm going to sign it anyway. Right? So what is
Yes.
your process, Nate? Which is what I love.
So I have been I've been very fortunate to have been doing what I've done for now almost 3 years. I have gotten quite a few people that have been referred to me through networking groups, through social media, family, friends, and it doesn't matter if you're my best friend and we've known each other for 20 years or if you're somebody that I'm speaking to for the first time. I'm always going to give you the best care, the best treatment that I can, kind of like a medical professional, um, where, bedside manner is so important, especially when it comes to teachers, especially when you're dealing with a very stressful time where you're trying to decide, do I want to continue in this career? Do I want to find something else? So what I've always said from the very beginning, even as Elizabeth and I used to have conversations like this, health insurance is a stressful thing. Let me stress about the health insurance, make that not be a factor in your decision because there's so many other things that go into it. It should just only be a minuscule part. But um, from my initial call with a prospective client, where I sit down, go over some different information that I would require. Apologies. I pretty much try to take a very full service approach. Um, I like to involve all decision makers. If I'm speaking to a wife, I might say, "Hey, do you think that your husband would want to be a part of this conversation? Your husband, wife, spouse, partner is if if I'm talking to a 23-year-old teacher, hey, do you want to have your parents join us on the call because you're going to be asking them questions anyway later?"
Mm.
Like, try to make it sort of a one-stop shop, a one-stop approach to where, because I don't want there to be a whole lot of back and forth if we can avoid it. So, hey, set aside 30 minutes to an hour one day. We can go over everything. And even if even if we don't get you signed up and a plan finalized right away, which is not the worst thing, I want people to be able to think it over and come up with questions so that I can answer them and make them feel more comfortable with what they're signing up for. Um, just take as much time as you need, because whenever you're ready to make your decision, I'll be right here and happy to help.
So the process is education. You're taking an inventory from them of who they are, what their background is, and who should be involved. So very holistic in that approach, I have to say. And then you're
Absolutely.
educating them on what's available, what could be possible, and then you lead them with all these options, because in life, what's the best thing to have? Options. That's when you don't feel stuck in something, right? You just provide options. Now they know exactly what each option brings and how much. Now you have a choice to make, and you can make it educated. Is that right? Have I summarized that?
I couldn't have said it better myself.
Okay, awesome, awesome. I love that. I love that, because that's what teachers need. Teachers needs clarity. They need clarity on, can I do this? What does it look like? And this is what's happening at school. Here's what can look like, and let me make it, right? That's what they need. They just, as you said, they're just in a crossroad that just makes them so stressful to think about this.
Precisely.
Yeah, yeah. So do you want to add anything else before? And we're going to have more calls like this, just so you know, in the group that we're going to be, Nate will be coming. So the more questions you have, he can answer you. And then Nate's information is going to be under the video here, so you can actually contact with him, make a meeting, and go through the process, so he can actually give you that education and a clarity, so you can make your choice, your option with confidence, right? So Nate, what do you have to say as we end?
Um, I guess the only thing I would say is that as the school year winds down, I do want to say thank you to all of the teachers that
Mm,
have had. Um, I know there's been a lot of people out there that have had very difficult years.
yes.
Um, Hopefully, this can be the turning over of a new leaf, whether it's, you know, you're if you're staying in teaching but you're going to a different school, if you're leaving the education field and you found your way into a new career, or if and I know this is the case for a lot of people, maybe you just got to give it one more year. And hey, it wasn't so great this year. Here's to hoping next year will be better. Just know that I'm right there with you. Obviously, I married a teacher. I've got teacher family members. I've got teacher friends. So I see all of the hard work. I see everything you guys are going through, and I just want you all to know that I support you. Um, when it comes to the health insurance side of things, do not. I implore you, do not wait until it's too late. I will have so many times available as we get into the end of spring, the beginning of summer. I'm going to be doing a lot of events in the community centered around going to schools in my hometown of Dallas, Texas, shaking hands with teachers. It's going to be a very teacher centric summer, if you will. So I look forward to speaking with you. I look forward to connecting with you, and most of all, I look forward to serving you.
Awesome. Thank you, Nate. Love it. Love it. And let's give the teachers some clarity, and then they have options to choose what they want to do with the healthcare problem. that they are facing. So congratulations on your baby. I can't wait to see her. And we will have
Thank
more
you.
before that. We will meet again on another Facebook Live with more
Absolutely.
questions. I think later in the day would be better because teachers are teaching right now. So that's probably
Of
why
course.
we don't have lots of teachers here asking questions. So we should do something in the evening or maybe weekend when we
I
have
would
more.
agree. That'll be whenever you're ready. I'll be around to chat.
Okay, awesome. Thank you. Have a blessed day. We'll talk soon. Thank you guys for watching. Thank you so much. Bye bye.
Thank you all.